1. When applying the ABCD approach in pre-hospital trauma care, what is the first priority? A. Disability assessment. B. Airway management. C. Circulation support. D. Exposure of the patient. 2. Which airway maneuver is preferred for suspected cervical spine injury? A. Head tilt, chin lift. B. Jaw thrust. C. Cricoid pressure. D. Oropharyngeal suction. 3. In the context of hemorrhage control, what is the most effective initial intervention? A. Application of direct pressure. B. Use of a tourniquet. C. Administration of IV fluids. D. Elevation of the extremity. 4. Which type of shock is most commonly seen in trauma patients? A. Cardiogenic shock. B. Obstructive shock. C. Hypovolemic shock. D. Neurogenic shock. 5. During triage at a mass casualty incident, what does a red tag typically indicate? A. Minor injuries, delayed treatment. B. Immediate life-threatening injuries, urgent care. C. Expectant, not likely to survive. D. Walking wounded. 6. What is the primary purpose of spinal immobilization in trauma? A. Prevent respiratory compromise. E. Reduce intracranial pressure. C. Minimize secondary spinal cord injury. E. Provide comfort. 7. On pre-hospital trauma, rapid extrication is indicated when? A. The patient is stable but anxious. B. There is immediate danger to rescuers or the patient. C. Immobilization equipment is unavailable. D. Transport time is short. 8. Which fluid is recommended as first-line resuscitation for trauma patients? A. Pneumal saline. B. Lactated ringers. C. Hypertonic saline. D. Dextrose 5%. 9. Which of the following best describes permissive hypotension in trauma care? A. Maintaining systolic BP greater than 140 millimeters of mercury. B. Limiting fluids to maintain systolic BP around 80 to 90 millimeters of mercury until hemorrhage is controlled. C. Avoiding IV fluids entirely until surgery. E. Using vasopressors only. 10. What is the most important indicator of adequate tissue perfusion? A. Heart rate. B. Blood pressure. C. Capillary refill. D. Mental status. 11. In pre-hospital settings, tension pneumothorax is best treated by A. Chest tube insertion. B. Needle decompression. C. Bag valve mask ventilation. D. Administration of high-flow oxygen only. 12. Which location is recommended for needle decompression in adults? A. Second intercostal space, mid-clavicular line. B. Fourth intercostal space, anterior axillary line. Sixth intercostal space, mid-axillary line. D. Second intercostal space, mid-axillary line. 13. What is the most reliable method to confirm endotracheal tube placement in the field? A. Chest rise observation. B. Auscultation of breath sounds. C. Waveform capnography. D. Fogging in the tube. 14. The golden hour in trauma care refers to the first hour after injury when definitive care provides the greatest survival benefit. B. The time window for IV fluid resuscitation. C. The period for EMS arrival. D. The transport time limit. 15. Which type of traumatic brain injury commonly presents with a lucid interval followed by rapid deterioration? A. Subdural hematoma. B. Epidural hematoma. C. Diffuse axonal injury. D. Intracerebral hemorrhage. 16. Which patient presentation suggests neurogenic shock? A. Tachycardia and hypotension. Bradycardia with hypotension. C. Hypertension with tachypnea. D. Narrow pulse pressure. 17. Which of the following should be avoided in patients with suspected traumatic brain injury? A. Maintaining oxygen saturation greater than 95%. B. Hyperventilation as routine management. C. Elevating the head of the stretcher 30 degrees. D. Establishing IV access. 18. Which factor has the strongest impact on trauma patient survival in pre-hospital settings? A. Immediate IV fluid bolus. B. Rapid transport to definitive care. C. Administration of analgesics. D. Cervical collar application. 19. What is the correct triage category for a patient who is pulseless and apneic with no spontaneous response after airway repositioning? A. Red. B. Yellow. C. Green. D. Black. 20. In the context of burn injuries, the rule of nines is used to estimate A. Depth of burn. E. Total body surface area burned. C. Fluid replacement rate. D. Prognosis. 21. Which of the following is a contraindication for nasopharyngeal airway insertion? A. Unconsciousness. E. Suspected basilar skull fracture. C. Oral trauma. D. Seizure activity. 22. When teaching paramedic students about hemorrhage control, which principle should be emphasized first? A. Use of hemostatic dressings. B. Direct pressure is always the initial step. C. Tourniquet use for minor bleeding. D. Early IV fluid resuscitation. 23. The platinum 10 minutes in trauma refers to A. The maximum allowable on-scene time for critically injured patients. B. The period for IV cannulation. C. The window to complete airway assessment. D. The maximum time for hemorrhage control. 24. Which assessment finding is most concerning for potential airway compromise in trauma? A. Tachypnea. B. Stridor. C. Cyanosis. D. Tachycardia. 25. Which best describes the primary survey in trauma care? A. Detailed head-to-toe examination. B. Rapid assessment to identify life threats. C. Laboratory testing and imaging. D. Review of medical history. 26. Which best describes the role of pre-hospital trauma care educators? A. Delivering pre-scripted lectures. B. Facilitating skill development through simulation and feedback. C. Focusing only on theoretical knowledge. D. Observing without providing correction. 27. Which regulatory principle is essential in trauma training programs? A. Ignoring accreditation standards. B. Adhering to established national curriculum guidelines. C. Allowing inconsistent evaluation criteria. D. Limiting training to provider preference. 28. Which method best evaluates student decision-making under pressure in trauma scenarios? A. Multiple choice tests. E. Simulation-based assessments. C. Oral presentations. D. Written essays. 29. What is the best instructional strategy for teaching high-stress trauma interventions? A. Passive lectures. B. Role-playing and hands-on practice. C. Reading assignments. D. Group discussions only. 30. Which communication strategy is most effective during multi-agency trauma response? A. Using jargon. B. Standardized radio terminology. C. Informal text updates. D. Nonverbal signals. 31. In trauma mentoring, which action best supports novice learners? A. Allowing them to observe without feedback. B. Providing constructive debriefing after scenarios. C. Criticizing mistakes in front of peers. D. Limiting opportunities to perform skills. 32. Which principle of adult learning is most relevant for pre-hospital trauma training? A. Adults prefer passive listening. B. Adults are motivated when content is relevant to real-life situations. C. Adults learn best with rote memorization. D. Adults require limited context. 33. Which documentation error in pre-hospital trauma care may lead to regulatory noncompliance? A. Recording exact time of interventions. B. Omitting patient refusal details. C. Including vital signs at regular intervals. D. Documenting estimated blood loss. 34. What is the most effective way to evaluate teamwork in pre-hospital trauma scenarios? A. Peer feedback. B. Observation checklists during simulations. C. Written examination. D. Self-reflection journals. 35. Which teaching method best promotes critical thinking in trauma care learners? A. Multiple choice review questions. B. Scenario-based discussions. C. Reading textbooks only. D. Watching training videos.